Altruism in Paramedicine. This poster is a summation of my scoping review entitled Altruism in Paramedicine. Thanks for listening. Altruism is the act of doing for others, without self-gain but with self-cost. Altruism is associated with compassion and the attitudes and attributes of caring. Acts of altruism are associated with professionalism and compassion and the easing of suffering. Acts of compassion and caring help to ease negative patient experiences, reduce vulnerability, and when coupled with a patient focus, lead to mutual trust between the paramedic and the patient. There is a paucity of data related to altruism in paramedicine, particularly in Australia. The practice of paramedicine has evolved over time. Factors such as varying patient acuity, broadening of scopes of practice, increased call volumes, increased clinical decision-making responsibility, and greater volumes of treat without transport cases could influence the practice of altruism and associated behaviours such as compassion and caring. Paramedicine is a complex and sometimes conflicting profession. A profession where paramedic and patient engagement matters. Our scoping review was conducted to further understand the role of altruism in paramedicine, to scope existing literature and identify research gaps related to altruism in paramedicine, both nationally and internationally. Initial review identified limited findings on the topic of altruism. Therefore, we expanded the search terms to include related patient care concepts such as compassion and caring. The preferred reporting items for systematic reviews and meta-analysis, PRISMA, the extension for scoping reviews, was used to guide the process. Search categories were orientated around the topic altruism and the field of paramedicine. Ultimately, the scoping review identified 27 articles. None of the articles were specific to altruism in paramedicine. This process is summarised in Figure 1 on the poster. Most of the selected articles, 13, hail from Europe. 5 articles each came from the United Kingdom and the USA. 3 articles hail from Canada and 1 article from Australia. The paramedic perspective was dominant, while 5 articles did review the patient perspective of paramedic care. Family and bystander care was also included. 3 themes were identified. Theme 1, caring interactions in the out-of-hospital setting. Theme 2, care impact. And Theme 3, paramedic education. Theme 1 identified that paramedics must maintain an awareness of the expectations and the life world of the patient while creating calm, trusting environments. Also while having an authority, being protective, respecting and flexible while communicating well and working effectively within a team situation. Theme 2, care impact, identified that prioritisation of the patient's viewpoint, facilitating patient-centred care and patient safety, providing reassurance, demonstrating situational control and instilling confidence all improve patient acceptance of care and a preparedness to hand themselves over in care. These factors are components of altruistic compassion and caring care. Theme 3, paramedic education. This theme identified that education in mindfulness, empathy, and ethics are important in caring education. Paramedics also need education in ethical caring competence, advocacy, diverse workplace settings, values-based practice, and situational responsiveness, as well as their emergency care. Paramedics should also receive education relating to care beyond the patient, such as caring for family and bystanders. Ultimately, paramedics need a foundation of emergency care skills and the ability to relate and work in multiple settings. Paramedicine requires paramedics with a skill set that is significantly broad and deep. These skills all exist on a continuum across from order and flexibility, slowness and speed, and during and across cases they need to be adaptable and with the ability to make sense of large quantities of information while tailoring care to the individual and that individual's perspectives. Future patients will be best served by an undergraduate paramedicine curricula that is well-rounded and inclusive of the facets of altruism, compassion and care.